Hi there. I want to take a quick moment to talk to you about knee pain and the 3 reasons that might be causing it that you could easily address in a good training program. All right, so the first reason, number 1, why you might be having knee pain is because your quads are way more overdeveloped and tighter than your hamstrings. Now, there could be many reasons for this. Maybe it's part of the exercise program that you're already doing and you're doing a whole lot of things like knee extensions and not balancing it out with enough hamstring work, or there's a really common issue that my wife had years ago, and I recently learned the proper term for it, or proper or whatever, but it's called gas pedal knee. And this quite often happens if it's your right leg that you're hitting while driving. Her seat was a little too far back and she was constantly reaching for that gas pedal and constantly over-engaging her quad. Now, this was a problem because the quad attaches to her knee and it would start to get really tight and kind of pull that kneecap into the joint. So when she would walk downstairs or try and do a lunge or a squat, the structure of the knee wasn't balanced and it was pulling that kneecap into the joint too much and it hurt. This can also happen because of maybe you wear high heels quite a bit and that the way that it puts you up there is a lot of quad engagement. So reason number 1 is an imbalance between your quads and your hamstrings. This is pretty simple to address. You can get a massage, foam roll your quads, whatever you need to do to get them to loosen up and relax a little bit, and then start doing a lot more hamstring work. And that could be stuff on the floor with a Swiss ball, whether it's Swiss ball hamstring curls or an actual hamstring curl machine, whatever it is, start doing a whole lot more of the hamstring work, loosen up the quads, get a nice stretch in the quads. It could be just kind of standing and holding it, or like an active PNF stretch. But very quickly, and I mean like within 5 minutes when I was first dating my wife, she noticed an improvement and the pain went away. So that could be very dramatic and very, very quick. Reason number 2 why you might be having knee pain that you can easily address in a good training program is poor ankle mobility. So the reason why poor ankle mobility can cause knee pain is twofold, right? So if you can't really get into good dorsiflexion because your ankle is too stiff and you can't drop down, whenever you jump off of something or come down the stairs, or if you play a sport and you're running around, part of the ability to absorb that force so it doesn't beat up your joints is this springiness, and you need all the joints to be able to bend smoothly in order to absorb that force. If the ankle doesn't move, boom, it's a lot more force going through your knee. So that's one reason. Now the second thing that can compound it, again, if that knee doesn't move and you need to get down or squat down to pick something up or do a movement, and you don't have the range of motion for it to go where the knee is supposed to go, right? The knee is pretty much like a hinge joint. It's kind of just supposed to go one way. But instead, you start making up for it. And we've all seen somebody do this where they go to pick something up and their knee dives in and they're going to pick it up. Now, you're asking your knee to kind of bend forward, but then also bend to the inside a little bit. And you start beating up a lot of the ligaments and tissues on the inside of the knee joint. That's a problem. So the way that you can address that is by freeing up all those soft tissues. So getting either a self-massage or a massage by a PT, chiropractor, or a good massage therapist to dig in, free up all the tissues around that ankle, and then you might want to do some types of joint mobilizations. You could talk to one of your doctors about getting a little distraction so there's a little more space between all the bones. There's also a whole bunch of different types of mobilizations you could do at the gym using super bands, and even just kind of a lowering exercise with your heel dropping off a box, so free things up and get a little bit more glide in the joint. Plenty of things that make a huge difference. And then once you've kind of gotten that ankle mobilized, then you can get a lot more stretching and slowly get more dorsiflexion into the ankle joint. Reason number 3 why you might be experiencing knee pain is poor hip stability. Let me explain. If the musculature in your hip socket isn't strong, you don't have good coordination to control where that knee goes as you drop into a squat or a lunge, any number of patterns to get something up off the floor, or you're doing a sport or activity, then your knee, yet again, just like with the stiff ankle, can end up going in the wrong places. So this is actually a matter of just simply practicing your squat, your hip hinge, and your lunge with good alignment in the knee. You can do this using a mirror. You can even do this using some types of giant rubber bands. If you have a friend, let's say your knee is always going too far in, You can have a friend wrap one of those bands around your knee, pull it this way, which seems a little counterintuitive because you're pulling it more in the wrong direction, but what it makes you do is respond to that pull and pull it back out. So now you're actually strengthening the muscles that are a bit too weak and need to engage more to keep it in good alignment. That's how you can help protect your knees with a good training program.